Today's webinar is entitled Anatomical Cardiac Survey, the four-chamber view, a case study analysis of hypoplastic left heart syndrome. And I'm really pleased to welcome today's speakers. We have, first off, Amy Zazera. She is a registered diagnostic medical sonographer at Santan Perinatal. She attended Gateway Community College in Phoenix, Arizona, where she received her Associates in Applied Sciences in May of 2017. Her current registries include obstetrics and gynecology, fetal echo, vascular technology, and abdominal small parts. Amy received her first position as a sonographer in maternal fetal medicine. She worked at a very busy clinic in downtown Phoenix, where she developed a passion for high-risk OB. Here she worked to earn certification in clear, cervical length, nuchal translucency, and nasal bone. As her experience grew, so did her fascination with the fetal heart and its complexities. By the end of 2019, she earned her credential in fetal echo. She enjoys working with and continuously learning from her perinatologist colleagues and patients. Along with Amy, we'd like to welcome Jason. Jason Grabham is a cardiac sonographer registered in pediatric, fetal, and adult echo. He began his career at the University of Kentucky Medical Center and has spent nearly 30 years in the field. Jason's clinical experience includes leading large, nationally ranked echocardiography programs, including Phoenix Children's Hospital and the Kentucky Children's Joint Heart Program in Lexington. Throughout his career, Jason has focused heavily on programmatic and community outreach development, quality improvement, and sharing his passion of delivering the highest quality imaging for patients with congenital heart disease. He is also a reviewer for the Intersocietal Accreditation Commission for Pediatric and Fetal Labs and is a fellow of the American Society of Echocardiography. Jason has shifted his passion from delivering quality patient care into helping to develop and inspire the next wave of sonographers in his new role of Director of Externship for WCUI's Phoenix campus. I'd like to welcome both Amy and Jason. Thank you.
Thank you, Malka, for that lovely introduction. Good afternoon, everyone. Thank you for joining us today. We're very excited to have you here. We're here today to talk about how important the cardiac evaluation is during the anatomy scan. Prenatal detection is key for finding heart defects. We'll dive into the four-chamber heart view in detail, show a case study on hypoplastic left heart syndrome, and then discuss that pathology from diagnosis to delivery and then on to neonatal outcome. I have a personal connection to this specific pathology, one that has really inspired and driven me to be very passionate about prenatal detection of congenital heart disease. And this is my colleague, Jason.
Hi, everyone. I just want to echo and say thank you all for taking the time to join us. I really appreciate the fact that there's so much interest in prenatal detection of congenital heart disease. It's really been a kind of a driving passion of mine for a lot of years. And so I'm really pleased to have you all join us today as we go through this experience together. And with that, I think we'll roll forward. So what are we going to get out of today? Well, our objectives are, we are definitely going to spark your all's interest in the complexities of the four-chamber heart as it pertains to congenital heart disease. And we hope to demonstrate the importance of identifying these defects prenatally and how important this multidisciplinary team approach is into doing that. We're also going to enhance your understanding of hypoplastic left heart syndrome, a very complex disease state. And as Amy said, we're going to talk about it from diagnosis on through interventions. And if we do this successfully, then together, we are going to increase the prenatal detection rates of congenital heart disease. And that's the most important. That is the best outcome we could all hope for.